Your kidneys have worked tirelessly for decades, filtering blood and balancing fluids. This video guides you through what happens to your kidneys as you age and the steps you can take to protect them for the future. We begin with Part 1, Understanding your kidneys. Before discussing how to protect these organs, it is vital to know what they do and why they are so important to your overall health. The kidneys are your body's silent workhorse, filtering an astounding 200 liters of blood daily. Despite this vital role, they often suffer in silence. Unlike other organs that signal distress, kidney damage is often severe before symptoms appear. Understanding their function and how aging affects them is key to protection. Kidneys are master regulators of your internal environment. They perform critical functions, including waste filtration, acid-base balance, blood pressure regulation, red blood cell production, fluid balance, and bone health. A decline in any of these functions creates ripple effects across your entire body. The kidney-body connection is profound. Organs like the heart, brain, and bones rely on healthy kidney function. When kidney function declines, it triggers a cascading decline across multiple systems, affecting blood pressure, bone density, and even cognition. Kidney health is essential to your overall well-being. Part 2 explores how aging changes everything for your kidneys. While aging is inevitable, the rate of kidney decline is not predetermined. By understanding the biological changes after 60, you can take steps to slow the process. Kidney function gradually declines after your late 20s, often unnoticed. However, at age 60, this curve steepens due to cumulative effects of blood pressure, diet, and stress. The encouraging truth is that lifestyle and early detection can dramatically slow this aging process, making 60 a call to action for long-term health. After age 40, kidney function declines roughly 1% per year. By age 70, many people lose up to 30% of their peak filtering capacity without symptoms. This timeline highlights the diminishing margin for error and the increased vulnerability to stress, making proactive management essential after 60. Each kidney has about 1 million nephrons, the microscopic filtering units that cannot regenerate. We lose nephrons steadily after age 25. By age 75, many people have lost 30% to 50% of their original count. Protecting the remaining nephrons through lifestyle and medical choices is the central mission of kidney health after 60. Reduced blood flow is another key factor in kidney aging. Arterial stiffening, reduced cardiac output, and atherosclerosis all limit blood delivery to the kidneys. This forces the kidney to work harder for fewer returns and makes it more vulnerable to acute injury. Kidney disease is often called the, quote, silent disease. Kidneys have a large reserve capacity. Symptoms usually appear only after 60% to 70% of function is permanently lost. For older adults, these subtle symptoms are often mistaken for normal aging. Therefore, routine lab testing is crucial. Do not wait to feel sick. We now move to Part 3, Risk Factors that Accelerate Decline. While aging is a factor, certain conditions and habits drastically accelerate kidney decline. Identifying and managing these personal risk factors is the most powerful action you can take to protect your kidney health. Diabetes is the leading cause of kidney failure. Chronically high blood sugar damages the filtering units over years, leading to diabetic nephropathy. This progression is not inevitable. Aggressive blood sugar and blood pressure management can slow or halt the damage at every stage. High blood pressure causes silent damage, resulting in reduced blood flow and nephron death. For people at risk, the target blood pressure is strictly below 130/80ths of a millimeter of mercury. Managing hypertension is essential, as even modest reductions significantly slow kidney disease progression. The overuse of NSAID pain medications poses a significant, underappreciated threat to aging kidneys. They can cause acute kidney injury or chronic, irreversible damage. Safer alternatives like acetaminophen, used within daily limits, and non-pharmacological pain strategies should be discussed with your doctor. Dehydration is an underestimated threat. Older adults often don't feel thirst until significant dehydration has occurred, compromising kidney function. Chronic mild dehydration stresses the kidneys, contributing to stones, infections, and nephron loss. A practical tip is to schedule water intake, aiming for 6 to 8 glasses daily. Heart and kidney disease are deeply interconnected in a bidirectional relationship called cardiorenal syndrome. Dysfunction in one organ drives damage in the other. Shared risk factors like diabetes and hypertension damage both simultaneously. Monitoring kidney function is a clinical necessity for adults over 60 with cardiovascular disease. Obesity and metabolic syndrome accelerate kidney damage through hyperfiltration and chronic inflammation. This constant overwork causes structural damage and nephron loss. Metabolic syndrome, affecting up to half of seniors, is associated with a 2 to 3-fold increase in chronic kidney disease risk. Genetics plays an unavoidable role in kidney health. Inherited conditions like polycystic kidney disease and Alport syndrome dramatically elevate risk. Even a family history of CKD roughly doubles lifetime risk. Inform your doctor about any family history to ensure an aggressive monitoring protocol. We move into part 4, recognizing the warning signs. Because kidney disease is silent until late stages, knowing what symptoms eventually appear and taking them seriously can mean the difference between early intervention and irreversible damage. By the time symptoms appear, significant damage has occurred, but it is an urgent call to action. Key warning signs include swelling in the ankles, foamy urine indicating protein leakage, persistent fatigue, and difficulty concentrating or brain fog. Changes in urination patterns are a window into kidney health. Nocturia, waking 2 or more times to urinate at night, is a classic early sign of reduced kidney concentrating ability. Other concerning signs include reduced output, dark urine or blood in the urine. Chronic, unexplained fatigue is a critical and often overlooked warning sign. It is caused by uremic toxin accumulation, renal anemia due to lack of erythropoietin, and fragmented sleep. This biological exhaustion is different from ordinary tiredness and warrants investigation. High blood pressure that resists multiple medications may be driven by damaged kidneys. The failing kidneys activate the RAAS system, raising blood pressure to maintain filtration. Managing the kidney pathology with appropriate medications is the most effective way to treat this resistant hypertension. Late-stage kidney disease can cause a metallic taste and loss of appetite. Uremic toxins create a metallic taste from urea converting to ammonia. They also trigger nausea and cause anorexia and weight loss. These late symptoms require prompt medical evaluation and urgent kidney function testing. We are now starting part 5, diagnosing kidney health. The tools to detect kidney disease early are accessible and affordable. Knowing what to ask your doctor for can enable timely, effective intervention before symptoms even appear. The glomerular filtration rate, or GFR, is the most important kidney number. Calculated from a simple blood draw, GFR quantifies filtering efficiency. A GFR below 60, regardless of age, warrants investigation and monitoring twice yearly at minimum. CKD is classified into 5 stages based on GFR. Most kidney disease in adults over 60 is stage 2 or 3, where function is mildly to moderately reduced and complications begin. Early stages require aggressive lifestyle changes and monitoring, while later stages require specialist care and planning. Routine annual blood testing should include serum creatinine to calculate eGFR. Other valuable tests include BUN, electrolytes, uric acid, phosphorus, and hemoglobin. Ask your doctor for eGFR and a urine albumin to creatinine ratio, or UACR, annually. Urine tests detect kidney damage earlier than blood tests. The urine albumin to creatinine ratio, or UACR, is the most sensitive test for protein leakage. Urinalysis and 24-hour collections provide further detail, detecting damage before blood values change significantly. Ultrasound imaging reveals the physical structure of your kidneys, complementing the functional information from blood tests. Renal ultrasound is non-invasive and can detect issues like small, shrunken kidneys, cysts, blockages, or tumors early, guiding complementary diagnoses and timely management. We move into part 6, protecting your kidneys after 60. The most encouraging truth is that much of the damage that leads to kidney failure is preventable. The choices you make now will determine the trajectory of your kidney health for years to come. Adequate hydration is the simplest and most accessible kidney protective action. Water filters toxins and flushes waste. Aim for 6 to 8 glasses daily, anchored to your routine, unless otherwise advised by your physician, as some advanced conditions require fluid restriction. A kidney-friendly diet involves 4 principles: reducing sodium intake to less than 2,300 milligrams daily, moderating protein, embracing plant-based foods for antioxidants, and severely limiting processed foods to avoid hidden sodium and phosphorus additives. Foods high in potassium, phosphorus, and sodium can be dangerous for aging kidneys that can't excrete them efficiently. Examples include bananas, dairy, processed meats, and canned soups. Always consult a renal dietitian if you have diagnosed chronic kidney disease. Blood pressure management provides dramatic protective benefits. ACE inhibitors and ARBs are preferred for CKD because they reduce pressure inside the kidney's filters. Consistent home monitoring and lifestyle changes, such as sodium restriction and exercise, are essential. Aggressively managing diabetes protects your kidneys. Key blood sugar targets, like an HbA1c below 7%, can slow disease progression. New medications like SGLT2 inhibitors and GLP-1 agonists provide dual benefits by protecting both blood sugar and kidney function. Exercise is a cornerstone of kidney protection, improving blood pressure, blood sugar control, and renal blood flow. Aim for 150 minutes of moderate aerobic activity weekly, such as brisk walking, to maintain vascular health and reduce inflammation. Medication management is critical. Be sure to disclose all prescription drugs, over-the-counter medications, and supplements to your doctor. High-risk agents like NSAIDs, contrast dyes, certain antibiotics, and herbal supplements can cause significant kidney damage, especially with declining function. Regular monitoring saves lives. Adults over 60 should be tested annually, and high-risk adults need testing every 3 to 6 months. Track the trends of your eGFR and UACR. A nephrology referral is necessary when eGFR consistently falls below 45. We begin Part 7, when kidneys fail. Despite prevention efforts, some patients develop kidney failure. Understanding the available treatment options provides dignity, independence, and preserved quality of life for patients and their families. Hemodialysis is the most common renal replacement therapy. It requires filtering blood through an external machine 3 times a week. It effectively clears waste and maintains balance, allowing patients to live for decades. However, it requires significant dietary and lifestyle adjustments. Peritoneal dialysis uses the abdominal lining as a natural filter and is performed at home, offering greater flexibility and independence than facility-based hemodialysis. This gentler treatment is highly successful for motivated seniors with appropriate home support. Kidney transplantation is increasingly common and beneficial in patients over 70, offering significantly better survival and quality of life than dialysis. Living donor transplants are ideal. A comprehensive evaluation ensures that selected patients achieve the best possible outcomes. Kidney health after 60 is not about accepting decline, it's about taking action. Hydrate daily, eat for your kidneys, move regularly, and test every year. Protect your kidneys today, and they will protect your tomorrow.